is Stephen Maher. I'm from Celbridge in Kildare, and I'm completing my Irish Cancer Society Research Fellowship here at Trinity College Dublin, St James's Hospital. I'm working on esophageal cancer. Esophageal cancer, or cancer of the food pipe, has increased very rapidly in Ireland, far faster than any disease. It's increased about 48% in the past 15 years. The standard of care for patients who have esophageal cancer is to receive a course of chemotherapy combined with radiation therapy prior to them going for surgery to remove their cancer. Unfortunately, about 70% of patients have little or no response to chemotherapy and radiation, and we don't yet understand why this is. With my research, I aim to look at microRNA genes. MicroRNA genes are a new class of gene that were just discovered a number of years ago, and we want to look at these in the tumours from these esophageal cancer patients and possibly in their blood to identify biomarkers or particular microRNAs that may predict whether or not a patient is going to respond to chemoradiation or not. In addition to that, I'm quite interested in radiation research, and we're lucky to have an X-ray machine here that's specifically designed for medical research, and there's only 2 of them in the country, so we're quite lucky to have that. Recently we identified a number of genes that seem to be predictive of whether patients will respond or won't respond to chemoradiation. And this is now being developed as a test by a company, and it's going to be tested over the next 3 to 5 years with patients coming through the hospital here at St James's. It's of great benefit for me to be working here at the Institute of Molecular Medicine at St James's Hospital for a number of reasons. There's a great cancer research base here, so there's a lot of other scientists to get ideas from. We also have very close proximity to St James's Hospital, so we have a close collaborative effort with the patients who come in who have esophageal cancer, and they're usually willing to give us material from their tumours for our research. I'm very honoured to be chosen as the recipient of an Irish Cancer Society Research Fellowship. These awards allow people in my position to carry out their own research ideas, and it's a great stepping stone towards independence in my research.
My name is Gregor Kianka, I'm from Germany, and currently I'm working at the Biomedical Diagnostics Institute in Dublin City University, where I'm conducting research which is funded by the Irish Cancer Society. My research involves looking at how tumor cells interact with the immune system, and I'm trying to use these new insights to develop novel ways of detecting cancer and trying to identify novel targets for cancer therapy. The aim of my Irish Cancer Society Research Fellowship is to develop a blood test which will allow us to identify these cancer-specific antibodies using a panel of markers and alert the clinician to a potential cancer diagnosis. My most important discovery so far was the identification of antibody profiles which are specific to colon cancer, and they discriminate between patients with the disease and patients who have no colorectal cancer. Now, this discovery will pave the way for a blood test which will hopefully allow early diagnosis of the disease. Currently, I am developing a microfluidic chip which will allow us to detect antibodies from colorectal cancer patients. The chip contains a panel of 22 biomarkers that we have identified in our previous study. The microfluidic chip technology will allow us to detect if a patient actually has colorectal cancer from a minute quantities of blood. I think such a blood test will benefit patients greatly in that the disease can be detected very early before it spreads to other organs, and this will allow to improve patient outcome and long-term survival. The Irish Cancer Society Research Fellowship will allow me to establish myself as a forerunner in the field of cancer immunology, but it also will give me a great opportunity to translate my recent findings from bench to bedside.
My name is Britta Stordow, and I'm originally from Sydney, Australia, but I moved to Dublin 2 years ago to be a postdoc, and I'm conducting my Irish Cancer Society Fellowship at the Molecular Pathology Laboratory at the Coombe Hospital. My research project involves looking for molecular markers of drug resistance in cancer cells, and the idea being that if we can understand resistance in the laboratory, we might be able to understand resistance in relapsed cancer patients. When a patient relapses after being treated with a chemotherapy drug, they can gain resistance because the cancer cells left over have changed in some way that causes them to fight the drug the second time around. At the moment, your doctor or oncologist will pick a chemotherapy drug for you based on what type of cancer you have and how advanced it is. But hopefully in 5 to 10 years they'll be able to actually test your cancer and go, we think this drug is best for you for the following reasons. And there's already a bit of a shift to that in breast cancer treatment. There's several categories and several therapies for the different types of breast cancer. My research project is investigating the order that we're giving chemotherapy drugs. The idea being that if we change the order, we might be able to prevent resistance occurring. One thing that many people might not know about is there's many chemotherapy drugs, not just one kind out there. And my research investigates a chemotherapy drug called cisplatin. And previous studies have shown that if you're resistant to cisplatin, you might be sensitive to another chemotherapy drug called Taxol. So I'm planning sequencing experiments looking at these two drugs, trying to figure out the best way to give them to cancer cells to prevent resistance occurring. And if it works in the cancer cells, it might work in cancer patients as well. Anything that we discover here in Ireland is going to help patients in Ireland as well as worldwide. I work on ovarian cancer, and there are approximately 200,000 new cases of ovarian cancer every year, and there are 400 new cases in Ireland. My research is focused on the treatment of ovarian cancer, and if we can make the chemotherapy more effective, hopefully we'll be able to increase the lifespan of women diagnosed with ovarian cancer. Receiving a fellowship from the Irish Cancer Society has been recognition for my career as well as for my research project. It's very nice to have that endorsement for your research. It helps when you want to try and attract collaborators both in Ireland and abroad to say that your research is funded by the Irish Cancer Society.